Hello again, everyone. In the following slides, I will be covering the following topics: healthcare access at the Greater Baden Community Center, local public health services in the District of Columbia, vaccination rates for preschool children compared to national statistics, disaster planning at the District of Columbia, health education promotion in the community engagement for a call to action, and lastly, my reflection. Access to healthcare services. The Department of Health defines access to healthcare services as the ability and ease that the group or individuals have in gaining access to appropriate, affordable, and quality healthcare services. The goal is to have every District of Columbia resident access to affordable, person-centric, and quality healthcare services in an appropriate setting. Access to healthcare at Greater Baden. The Greater Baden Medical Services is a federally qualified non-profit healthcare center that has met government standards for providing quality healthcare. They provide primary and preventive care services to both insured and uninsured patients. They also partner with the government, social services department, faith communities, businesses, and non-profit leaders to provide services for over 16,000 patients at 6 locations each year. It is considered as the to-go healthcare access point in the service area. They also receive United States Department of Health and Human Services funding and has federal public health service deemed status with respect to certain health-related claims, including medical malpractice claims for itself and covered persons. Services that are available at Greater Baden. Greater Baden provides a range of services to address the residents of DC's needs. These include pediatric care, adult care, dental care, substance abuse treatment, HIV/AIDS treatment, veterans medical care, health education, outreach and WIC services, behavioral health, case management, perinatal and women's care, and referrals for other medical specialists or clinics. Local public health services in the District of Columbia. The District of Columbia provides a range of local public health services to the residents. These include genetic counseling and education, family history taking and physical examination, diagnostic procedures, laboratory screening and testing, evaluation and diagnosis, treatment and management, referrals and follow-up services, transportation services, interpreter services, in-home services, and free government fitness services. What else is needed in the District of Columbia as far as healthcare services? Even though the DC government provides a range of services to the residents, there are still gaps in the services that needs to be addressed. According to the Healthy People 2020-2016, even though the residents in DC enjoy higher health insurance coverage compared to the nation, there is still barriers to receiving health care services that disproportionately affect certain residents regardless of their coverage. This was retrieved from DC Healthy People 2020-2016. The goal is to reduce barriers to access regardless of insurance coverage, age, or gender, or race. Vaccination rates in the state of DC. The Vaccination for Children program, which is the VFC, is a part of the DC Health Immunization Program. It is a federally funded entitlement program that provides vaccines free of charge to enrolled providers that serve eligible patients. The VFC program helps to ensure that all children have a better chance of getting their recommended vaccination on schedule. Vaccines are also recommended by the Advisory Committee on Immunization Practices, which is the ACIP. The Center for Disease Control and Prevention, CDC, also annually analyzes school vaccination coverage data from federally funded immunization programs. The school entry coverage for most awarded programs was at or near National Healthy People 2020 target of immunization at 95%. Vaccination coverage levels for 2 doses of MMR vaccine, 4 doses of DTaP, and 2 doses of varicella vaccines. Low vaccination and high exemption levels can cluster within communities, increasing the risk of disease. This was retrieved from Morbidity and Mortality Weekly Report, Disaster Planning 2013, in the District of Columbia. The uninsured and underinsured
Office of
Risk
Management
free
is
of charge
with
at a
ensuring
federally
that
qualified
every District
Health
of Columbia
Center agencies or
has
their
an
American
emergency
Indians
response
or
plan.
Alaska Native. Also, OSHA standards require written emergency evacuation plans under the General Industry Standards 29 CFR 1910.38. The Risk Management Identification Analysis and Control, the RIAC division, continues to work with Risk Management Agency on evacuation planning together with the DC Fire Department and Emergency Services. To proactively protect health, economic, and social well-being of its workforce, citizens, and resources, all agencies are required to have an approved ERP in the workforce. The District of Columbia Office of Risk Management requires that the plan be updated as changes occur within the agencies. For example, if personnel or building locations are changed, an approval form for the DCORM is required. Where to go to obtain and learn or be involved. The Agency for Risk Management is the point of contact for implementing district-wide and agency risk management initiatives. Their responsibilities include implementing integrated risk and safety-related program, function as agency safety officer, balancing safety needs and priorities with available resources. They work to ensure the highest level of safety and security to every agency employee. The community engagement call to action. It's the national call to action for moral revival is a tour of thousands of poor and moral individuals that plan to gather at the nation's capital around June 2020 to demonstrate their power and allow their voices to be heard. The call is for all people that cares about the poor and the low wealth individuals like the sick, immigrant, workers, the environment, people with disability to vote. It is effective because it allows for peace over war. The AESAs are agencies that organize conferences advocating for education and empowering educators like principals, teachers, instructional coaches, etc. at a roundtable conference. It is effective because it teaches and leads. I will wrap up the presentation with my reflection. The well-being of the citizens of any country is key in measuring the success and or failure of any government. The health of the citizens should supersede anything else. Nothing should be of importance to any state than its public health. According to the Healthy People 2020-2016, even though the residents of DC enjoy higher health insurance coverage levels compared to the nation, there still remains barriers to receiving health services that disproportionately affect certain certain residents regardless of coverage. Therefore, ensuring that all residents have access to equitable care and to reduce differences in health outcomes among various racial, ethnic, gender, and socioeconomic groups will promote healthy and productive lives to DC residents. This was with three from Healthy People 2020-2016. There ends my presentation. Any questions? I'm open for questions. Thank you.